Colette from Down Under, and 9 months ago I had a reverse total shoulder replacement. And the reason that I'm putting this YouTube together is because at the time prior to having my shoulder replacement, I was looking on YouTube to find other people that had had them and to see what sort of outcomes they'd achieved from having their reversed shoulder, and there wasn't very much out there, so I thought I'd share with all of you that might be needing to have one the results that I've managed to get. So I guess my condition is one of an inflammatory arthritis that I've had for many years, and that's the reason why I needed to have the reverse as opposed to a standard total shoulder replacement. I did have missing rotator cuff muscles and muscles that needed to be mended, so it was always going to be a little bit iffy as to how good the outcome was going to be in terms of the range of movement, but really I didn't have a huge amount of choice. I needed to get it done. So as you can see, that's the scar, and prior to having the surgery it was pretty much like this shoulder, because this shoulder is also bad. So this one, you can see it doesn't really move in its socket at all, and that's as far as I can get it to go, and that's as far as I can get that one to go, and that's exactly how the other one was. So 9 months down the track, I'll now show you how it's gone. So if I go forwards and I'll turn sideways, that's probably about 160 degrees, and I can also go out that way and up that way, which is awesome. It's been about 15 years since I could lift my arm above my head, so I'm very happy about that. And behind my back, that's about as far as I can go behind my back, unfortunately. And then the other issue is out to the side. It doesn't do very well there, but I guess I'm pretty happy with the results. My surgeon wasn't expecting someone with the length of my condition and the amount of damage that was in the joint at the time, and the fact that I hadn't actually had much range of movement prior to the surgery. All of these things led us to think that maybe I wouldn't do so well, but it's much better than expected. So yeah, if you guys are thinking about having one, I suppose my tips would be, I did a bit of research on surgeons, and I asked my surgeons or prospective surgeons how many reverse shoulders they'd actually conducted, because it is different to doing a standard shoulder replacement, and I found one that was used to doing lots of reverse shoulder replacements. I also really stuck to the rules. The physios give you exercises to do, and especially straight after surgery I really stuck to those rules. And yeah, really, I guess if I was going to push my boundaries with any of the exercises, I'd kind of check in first on whether it was going to potentially pop my shoulder back out or something like that. I was always a bit worried about that. So yeah, it's always just best to check with your physio and your surgeons. But it's been a real success, and obviously I have to have the other one done at some stage, so I'm feeling quite comfortable about it. So bye for now.